morning for Unveiled surgery. You're through to go again. How may I help you?
So bring him in today at 3, all right?
I literally feel like I've been hit by a bus some days.
Have you been eating?
Yeah, I had a big fat kebab and everything, so I was all right.
Go to the toilet a few times a day. And when I gotta go, I literally have to go.
What, it's stand back, I'm coming through?
Yeah, like if anyone's in there, they gotta get out.
The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards.
I've got a 33-year-old lady who's been diagnosed with gestational diabetes. Most of her readings are high.
Are you using any contraception at the moment?
I'm a lesbian, so...
OK.
Yeah.
All right, so you don't need any contraception cover?
No.
Can I just tell you a good joke?
All right, go on then.
So there's a nightclub and there's a fight in this nightclub, and this blonde comes out covered in blood.
Hello, Fibromyalgia surgery. Nikki speaking. How can I help?
Mr. Bunting? Bye. Sir, come in.
About 2 weeks ago, I got a little black lump underneath my tongue.
Right.
I just want to find out what it is.
And it's stayed the same since you first noticed it?
It's got a little tiny bit bigger, but it's not massive. It's just...
OK, I'll have a look. It's just the light.
Oh, right.
OK? So if you open your mouth. Right, and it's not causing you any pain? And...
I'm a bit worried because I had a tumour took out there.
OK.
So how can I help today?
It hurts. I had labour and it's worse than that.
OK, worse than labour?
Yes.
That must be the worst thing imaginable then. I can't imagine anything worse than labour.
It hurts. I stand up, it's easier. It starts from there,
Yeah.
goes round, down there, and to there.
OK. And that's been since...
Tuesday.
Did it come on gradually on Tuesday, or did you suddenly...
No, I just woke up.
You woke up with it on Tuesday, and it was like that? You hadn't done anything on Monday that might have caused it?
Nothing, no.
You weren't out digging the road, or...?
No, I was behaving and I wasn't swinging from any trees and stuff.
Right, not...
No.
OK, yeah.
Took 2, naproxen, and I took 4 paracetamol.
Took the edge off it, didn't touch it?
Nothing, no.
Nothing? And pulling a wing's OK?
It's fine, yeah.
OK. Right, let's have a look at your legs. Well, wait, back first of all. Just stand up for me. I can sit down. That's OK? Yeah. OK, can I lift this up?
Yeah.
Okay, so whereabouts does it hurt?
There.
There. OK. Does that hurt?
Yes.
How about yes then? Does that hurt there?
No.
But that hurts that side there?
Yeah.
So all the way across there?
Yeah.
And then down here, does that hurt?
No.
OK, so can you touch your toes? How good can you get? My glasses.
There.
OK, how far back up can you come? How far back?
Oh, no.
No?
No.
Can we lie you on the couch? I just want to lift your leg in there, is that OK?
You've got a step then.
Got a step? I'll give you a boost if you want.
OK, one moment, bear with me.
And you did mention that in the past you'd had to have something removed.
They called it a Warfin tumour. W-A-R-F-I-N. Warfin.
Warfin's tumour, there we go.
Oh, it's got a T in it, has it?
OK, so I'm just going to go in and just sort of feel this area that you mentioned. When I squeeze it, it almost seems to disappear in terms of the colour, and then it returns. It almost feels like a blood vessel in the area.
That's what the wife said.
Did she?
Yeah.
OK.
And I thought it was going to disappear on its own, but it hasn't. And I'm just a bit worried as to what it is. But...
OK. I mean, even the thing you had before was a benign sort of thing, and it wasn't sort of a cancerous thing which could potentially spread. So I don't think there's any association between this and what happened before in 2005. Can I just check the glands in your neck just to see if there's any enlargement? It's fine. And you've been well otherwise?
Yeah.
Any weight loss at all?
This is it, yeah. I've lost quite a bit of weight. The wife says it's down to eating better, but I don't know. I mean, I haven't lost an appetite.
Has she changed your diet?
And she's retired now, so It's a lot more healthy food.
Can I check your weight? You can leave your shoes on if you want. It won't make it.
I would do, but they're still toe cap. I think
Sometimes.
I think I've gone down to about 15 stone or so.
It's actually the same.
The
As
same?
what it was in January.
Oh, it must be the scales at home then.
Going back to your this thing under your tongue.
Yeah.
Personally, I would say I don't think it needs removal at this stage. For my estimate of looking at it, it measures about 2 millimeters in diameter. If it doubled its size, I would want this to be looked at a bit further. But I think we can watch and wait for now.
Nothing to worry about then.
No. Okay?
Yeah, that's fine.
All right.
Okay.
Take care. Bye-bye.
Thanks very much. Then.
See you.
Bye.
Is that hurting?
Yeah.
When I do that, where does it hurt? In the back. How does that make you feel when I do that?
Oh, yeah.
Makes it worse, yeah?
Yeah.
How to bend your... there. Is that okay?
Yeah.
Okay. Should we sit you up? Okay, just swing your legs around. Just come have a seat.
Oh, what have I done?
Okay, right, so this feels like the muscle in the back. It's a very common thing. It's the commonest cause of backache probably is the muscles. And being as we are upright on 2 legs, and so 50% of us will get backache at some point, and often we don't know what's caused it.
No.
Yeah. As uncomfortable as those chairs are, you need to sit in an upright chair, not in a lounge chair, because it curves your back. The treatment is not to lie down and rest. The treatment is to keep mobile, but not to bend and not to lift. The warning signs of backache are numbness on the bit of your bottom where you sit on the bicycle saddle, or if you can't wee, or if you're incontinent to poo. That's that's what we call a red flag. That's straight to hospital. Don't pass go. Don't collect any money. Just go to hospital. So, shall I give you some cocodamol, which is codeine plus paracetamol?
I'll take anything.
Will you?
To get rid of the pain, yeah.
Okay, so you can take naproxen with these, okay, but you can't take paracetamol with them. Keep moving, and it's not better than a week, you'll probably be seeing you again, but if you've got those red flags...
I will do, I will do.
Nice to see you, take care. And you, all the best. Bye-bye, Sue. Bye-bye.
Hello. Bye-bye.
Hello. How are you?
Hello. Hi. How are you?
You did it again. You did the weird hello.
Oh my God. They keep moaning about my hello. Was it that bad? Hello. Did you like my hello? Hello. Hello. Who comes out? Hello. That's not my fault, is it?
Are you okay?
How are you?
Yeah, not sure bad. Okay.
Good.
It's all right.
Well done for coming to see me.
Okay. Blood test or?
Yes, completely. I was going to call you, but then I realised you had an appointment with me, and I thought I'd wait and see to see if you attended. So this is your cholesterol level. It's 5.7. Okay.
Is that low or?
That's high.
Is that high?
But this particular type of fat, it's called your triglycerides, is really high.
Mm-hmm.
The normal range is 0.45 to 1.82, and yours is 7.6.
7.6.
But 2 years ago when we spoke to you, it was 14.
14 was
So it has come down, but it's still really high.
Yeah. Sometimes, I've been to the parties, things and drink and eat too much, mutton or fat food.
Okay, with this particular type of fat, called your triglycerides, if it's really high, you're at risk of causing inflammation to your pancreas, which is the organ which secretes insulin, which controls your blood sugar levels. So we do worry about it, okay? How would you feel about starting some medication? Because this is all a risk factor for heart disease, putting you at increased risk of developing a heart attack or a stroke.
Oh, it's lovely blue.
I looked out the window and I thought, maybe not black today. Come and sit down.
You're looking very lovely.
Love your hairband. Very pretty.
Cereal.
Where are all these badges from? You should collect them.
Yeah. There's about 60 on here already.
I love your T-shirt, by the way. I wish I could wear T-shirts like that. Yeah.
I love your blouse. It's lovely.
It's lovely, isn't it? £4 eBay.
Really?
I just thought 32, 34, that'll do me. As long as it covers my big swollen arms, I'm happy.
You need to understand that this is putting you at completely high risk, and we need to try and control it and bring it down. So yes, your diet is really important. You need to cut out the fatty foods. You need to cut out the fried foods. Try and do some more exercise.
Yeah.
Do you smoke? Remind me.
No, I'm cut down now. Sometimes smoke 1 or 2 a day.
Okay. And how much alcohol are you drinking?
It's nearly quarter bottle like that, quarter cup bottles. whiskey like that.
I'm sorry, a quarter bottle?
Yeah.
OK. For you, because your levels are so high, I think you need the help of medication as well. Are you willing to give it a go?
Yeah.
Yeah?
Oh, yeah.
OK. I want to start you on a low dose to make sure you see your body gets used to them. OK, and then we'll do a blood test in, say...
6 months? Oh.
Yeah, in 6 months' time. OK, to see how you're getting on with them.
Okay. Thank you, yeah? Take care.
Bye-bye.
Bye.
Right, I've just seen Dr. Bulger, and she'd agreed to give me a prescription. She forgot to give it to me, and I forgot to ask for it.
Might be in her room. Okay, I'll go
Okay,
and get
thank
it.
you.
I'll go and get it for you. Hiya, Mr. Harris. Just going to take his prescription.
Forgotten his prescription.
Thank
yeah.
you.
Thank you.
Mr. Harris. Where's he gone? Where's he gone now? I'll see you. I've lost a patient. Where's he gone? Lost a patient. Mr. Harris. Thought I lost you. What's the address, please?
Thanks for coming in. Is it because we've been pestering you to come and see us?
Yeah. Basically, you said I had to come and see you before you could issue me a sick note.
Yeah, because I want to see you, catch up with you and see how you are. Yeah.
Well, I'm not too bad, to be honest. I'm still like a little bit depressed and I'm not getting no help from nowhere. And like my Crohn's disease is still the same, but I ain't getting no help because I can't take tablets. So it's not getting no better for me.
Okay, so talk me through not being able to take tablets.
I went in hospital, I had pneumonia, like I never took tablets before that, and they tried crushing them up, everything, and I just kept throwing them back out, just won't go down. Like, it's just the thought of it.
It's a psychological thing.
Yeah, I don't know why, as soon as it goes in my mouth, I just throw it back out. Like, I got so bad, they had to like operate on me to get the fluid out of me. I had to use like a drill to drain to like my lung and take the fluid out that way.
So this is having a big effect on you then? You're not getting better because of it?
Yeah, no.
So tell me how your Crohn's disease is, as you're not having any medication.
Well, that's quite bad, to be honest with you. I go to the toilet like a few times a day. And when I got to go, I literally have to go.
What, stand back, I'm coming through?
Yeah, like if anyone's in there, they got to get out.
Okay. And is it loose?
It's never been like so, there's always been like water.
Okay.
And it stinks.
Yeah, okay. And any tummy pain or?
No, not really.
No? And how's your weight?
Before I had the operation, I used to be like 16 stone, used to be pretty big, and I went down to like a stick.
And can you tell me about your diet? I mean, do you have to watch what you eat, or can you?
No, I don't. I can't eat dairy products or anything like that. I've been told that much, but I ain't been told nothing further than that.
Have you seen a dietitian?
No.
Right. Okay. Would you like to?
Yeah, I would. Yeah.
Okay. And then you said about your mood.
Been an ongoing problem, and like I don't have any motivation to do anything. Even like when it comes to having a conversation with someone, like I find it hard sometimes. I don't know what to say in there. I just gone really low, like low esteem, I suppose.
Do you feel bad about yourself?
I do sometimes. Like I get like bad thoughts about myself, but not all the time.
Okay. What are these bad thoughts about yourself?
I don't know. Just like feel like not wanted and stuff like that.
Like not wanted.
Yeah, like things like that.
Lily Ellis. Hi, morning.
Hiya.
Okay.
Okay. I'm going to Greece on Tuesday.
Okay.
And I'm due on my period that day.
Okay.
And I just wondered if there's any tablets you could give me just like the pill, just while I'm away.
Okay.
Because I don't really want to be in Greece.
Where are you going?
Crete.
Nice. How long are you away for?
2 weeks.
Okay. So when was your last period?
The end of last month. So I'm due on.
So you're due on any time?
Yeah.
And can I ask, are you using any contraception at the moment?
I'm a lesbian, so.
Okay.
Yeah.
All right, so you don't need any contraception
No.
cover?
No.
Excellent. All right. So in that case, and because it's such short notice,
Yeah.
there is something that we can give you.
Okay.
You're going on Tuesday, did you say? Okay, so I would probably start taking it on Saturday.
Okay.
Okay, just so that you take it 3 days before you're due to start on. And then take it for the time that you're out there. And then you need to stop as soon as you come back, because we don't normally give it for more than 2 weeks.
Yeah, that's fine,
that'll be slightly there. For now, this will be okay, and you don't need to worry about contraception,
No.
so that's okay. I prescribed norethistrone for Lily, sometimes known as the period delay tablet. Norethistran is a synthetic form of the female hormone progesterone, which is responsible for maintaining the lining of the womb and prevents it from being shed. So this medication can help women that want to delay their period for some time. It can also help women who suffer with heavy, painful periods. It can have some side effects, such as bloating, nausea, breast tenderness, and it can also have an effect on women's cycle after they stop using it. The tablet is not known to have an effect on ovulation or the fertility of a woman. So when you come back and you start your period, things may be a bit abnormal for a couple of months. That's just the effects of the hormones and the pills.
Fine,
Okay, so don't be alarmed.
Okay, that's fine.
So start taking this from tomorrow.
Okay.
1 tablet 3 times a day. Okay.
All
Have a
right.
great time.
Thank
All right,
you.
See you then. Bye-bye.
Do you feel like hurting yourself?
I did once, like on my arm there,
Uh-huh.
but that was about 4 or 5 months ago.
Okay. So nothing recent.
No,
and,
nothing
and,
recent.
and any thoughts about committing suicide?
No.
Okay. Do you drink alcohol?
Sometimes,
Okay.
but not all the time.
So how often do you go out for a drink?
Well, I've been out for about 2 months.
Okay. Do you smoke?
Cigarettes, yeah.
How many?
About 10 a day, 11. I'd love to stop because it's so expensive, and
Yeah.
but I just every time I try, I get 2-3 hours into it, then I have to start smoking again.
What? Okay. Would you like some help with that?
Yeah, I would.
Okay. So I arrange you to see our smoking cessation clinic here.
Yeah, that'd be good.
Okay. And do you use any illicit drugs, cannabis or anything
No.
else? No.
No.
Okay. Right.
I couldn't afford it.
Okay. Let's put them on the scales. No. Okay, that's 75.
How much is 75?
That is about 11 3/4.
For a lot, is it?
So I'm much, as a doctor, for your height, happier with you being 11.5 stone than 16 stone.
Yeah.
And then I wonder about getting you to go and see talking therapies to look at your depression.
Yeah, they were going to send me to that.
But also to see if we can help with this not being able to take medication issue.
Yeah, that's a big issue.
Okay, so that's 4 things. Dietitian, smoking,
Yeah.
talking therapies, and gastroenterology. So, okay, Michael?
Yeah.
You can read my scribble. Okay, thanks for coming in. Okay, take care. Bye-bye.
I've got sausages, I've got sausages. And then she went,
baked beans.
I want to sing now. Because you maybe want to sing, but I don't want to sing.
What sing? What sing? What song? What sing we singing?
Wheels on the bus go round and round, round and round, round and round.
Now, it's time for the appointment.
Come on in, Maria.
Thank you.
Through. So, I saw you last week, didn't I? Week before?
Just over, yeah, week before.
Doesn't time fly when you're having fun?
It certainly does.
And we did loads of bloods, didn't we?
We did.
Because you're struggling with your back and I'm struggling with your back, yeah?
I'm struggling with everything. It's not even just my back. My toes hurt, my arms hurt, my shoulders, my collarbone, you name it, and it hurts.
Maria has been having problems with her back since the late 90s. She's seen physiotherapists, she's seen pain clinics, and she's seen orthopaedic surgeons. She's had repeated scans which have shown some disc damage and more recently some wear and tear of the facet joints. In 2013, the surgeons tried a decompression, which is where they took the disc out and they fused the vertebrae. But unfortunately for Maria, it hasn't really worked. I did some bloods to look at how your immune system was working, and one of them was just a little abnormal. Nothing. The lab are basically saying we don't know if that's anything to be concerned about or not.
Yeah.
And it should be repeated in 3 months. There's certainly nothing that's jumping out of those bloods, but we can't leave you like this, can we?
No.
Maria has been diagnosed with fibromyalgia. Fibromyalgia is a collection of symptoms. It's a syndrome. To diagnose it, it really needs to have been going on for at least 3 months. Patients report widespread pain, tiredness. They also have problems sleeping, and they describe memory problems, so difficulty in thinking clearly. It's moved from just your back, which is where we used to send you to.
I literally feel like I've been hit by a bus some days. I can't sleep. The pain is waking me up. I'm miserable.
There are 2 options, I think. The first is to get you off to see a rheumatologist to explain that things have changed. and for them to check that they don't think there's anything that we're missing that we should be treating. I may well have to go back to the pain clinic because I'm struggling to think what else we can
Whatever
use.
you recommend, I'm happy to go with.
It's very frustrating, very difficult when you see a patient whom you've worked through all the usual treatments that you would offer for their pain and you're really not making any impact on it. It's very distressing for the patient and very disappointing for the doctor.
Everything hurts. Fed up with moaning. My lot I must be driving them insane.
Hi, how are you?
Okay, I don't know if you had the A&E report. She fell back onto the floor while she was playing with her dad off the sofa. I can't even remember how long she was actually not breathing for. She went blue, rigid, and fell. And then a couple of weeks later, she did it again.
Okay, so what?
But it wasn't as bad.
What happens?
You know when you're crying but you don't take a breath?
Yeah.
She just didn't breathe. She went blue.
How long did that last for?
It felt like it was forever, but I think it was probably 5 minutes, the whole process. When she did come around again, she was slurring, she was still woozy. But once she made it to A&E, within like half an hour of being in A&E, she was back to normal again.
Right. And that was that one episode?
That was that one episode. Then it happened a couple of weeks after. She went from her room to her brother's room, slipped on the floor, and her brother went off on one. I was like, what's wrong? What happened? Safa's not breathing.
Wait, did you see that long breath pause or anything? Or was it
No,
just
but her brother saw it.
Okay.
I know he's only 4, but he's quite aware because he was there when it happened the first time.
Okay. Did she actually go blue the first time?
She went blue, lips, face, everything was just blue. It was horrible.
I want to hand in these.
What is it?
This is Lily. Sorry.
What?
I'm excited. I have it today.
Is it open?
iPad's okay.
Yeah.
That's all right.
I've got some special things for you. Because you're living.
Oh,
yeah.
yeah.
That is not
Oh,
naughty.
thank you.
So what you're taking at the moment?
Gabapentin. Can you actually do my prescription for me while I'm...
So you're on
Gabapentin.
duloxetine, gabapentin, amitriptyline.
I'm not taking the duloxetine.
You didn't like that, did you?
It gave me really bad nightmares and made me sweat like a workman.
Okay.
It wasn't pleasant.
So let's get rid of that.
I tried. I couldn't persevere
No,
with that one.
no, that's fine. Have you been on patches?
No.
That's another option, isn't it?
I'll try anything at this point.
When did you do the talking therapies, pain management stuff? Was that recently?
No, it was quite a while ago.
Right, but you're happy with it? You know what you're doing with it?
I'd
They
sort
give
of-
you sort of exercises.
Yeah,
and things,
you
don't they?
get exercises. To be honest with you, I think the I can't remember, is it psychologist?
Psychologist, yeah.
I don't think she liked me very much.
Why?
Because she kept talking about think positively through your pain. And I was like, I completely understand what you're saying, but with all due respect,
When it's
if
bad,
I've
it's
got
bad.
a physical problem causing the pain, all the positive thinking in the world isn't going to take that away. And because she couldn't argue, I don't think she liked me very much.
Sure she did, but yeah, I mean...
But no, I get all of that.
The results were good. Prescription's gone. We'll wait and see what the rheumatologists think.
Okie-dokie. Yeah, great. Thank you very much.
No problem.
Have a good day, and you.
Bye-bye.
Bye-bye.
How are you feeling, sweetheart?
I'm all right.
You weren't looking good at all.
I ended up with shingles.
Oh, God, that's so terrible.
Yeah.
Poor kid.
That was like 4 weeks ago.
Oh, no. That's the worst. Anyway,
Still
that's a
Are
love.
you getting home?
Rosie said to fish my car just packed up today.
All right, sweetheart. No problem, darling.
No, it sounds like this could have been what we call a breath-holding attack, okay? So sometimes what happens is kiddies can hold their breath, go blue,
and it can be very, very dramatic and obviously quite distressing for the parents. There are two types of breath-holding attacks, and they're divided into blue or white. Blue breath-holding attacks are far more common and essentially occur when the child is in pain or frustrated or angry. The lips may go blue and they lose consciousness. With white breath-holding attacks, they're also known as reflex anoxic seizures. It usually occurs after a sudden fright or a sudden onset of pain, for example, a minor head injury. They will go pale, limp, and there will be loss of consciousness. Occasionally, they also look like they're having a seizure where their limbs will go very firm and there can be some shaking movements. What I'm going to do, I'm going to examine her, of course, now. What I'm going to do is I'm going to put you into my colleague, who's essentially got a specialist interest in paediatrics. I'm going to get her to review and make sure that she's happy with the history as well. Does that make sense?
That's fine. I just want to check there's nothing long-term.
Absolutely, absolutely. No, of course. Pop her on your lap for me.
Go on. Go and sit on my lap.
Okay. And lift it up right up for me. Let's have a listen to her chest. Spin her around for me. Good, okay. So since the third, she's been back to her normal self, running around, playing active, no concerns?
Yeah.
Good, okay. Breath-holding attacks are not a sign of anything more sinister. However, occasionally they can be confused with epilepsy, which is why it's important to seek immediate medical attention if something like this occurs. If, of course, an episode recurs, you've done absolutely the right thing. I'm sure in A&E they showed you the basic things that you should do. So if it does recur, make sure you seek immediate medical attention. All right? Lovely. No trouble. All right, bye-bye now.
Your lights are on.
Thank you.
No worries. And that's good observancy.
Good observancy. Is observancy a word, though?
I don't know.
I bet you used to say millennium as well, didn't you?
Who?
Millennium for the millennium. Millennium.
Yeah. Can I help you?
OK, come in. Have a seat.
I've been given these tablets.
Yeah.
And these. And I'm also taking citalopram. But I haven't been given, they haven't been put on my repeat prescription.
Okay.
So I haven't taken them for a month.
Which one have you not taken?
Both all of them.
Right, OK. Whilst you're here, it would be an opportunity to just check if anything's changed since you were last seen.
No, nothing's really changed. It's just that I just don't like.
Because you used to take olanzapine.
Yeah,
now you're on this.
Yeah, I'm on that.
And do you think there's been any improvement?
There's been a little bit of improvement, but as I said, I haven't had them for about a month now.
Okay.
And I'm thinking that I'm getting all these thoughts back in my head.
Right. Robert suffers with schizophrenia, particularly psychosis. He suffers with symptoms of hearing voices, as well as symptoms of feeling quite low and depressed. This has developed during his 20s. He was someone who was functioning quite well. He held various jobs during his life, but unfortunately he went through difficulties. He wasn't able to function. So he started an antipsychotic medication. During the time he was on the medication, he became type 2 diabetic. Okay, if you ever get into a situation where your medications aren't there, and, you know, they say there's no appointment, somehow or another we need to contact you even on that day so that at least we can sort it out. And usually we can see you even as an emergency or do it over the phone. And then with the diabetes side of things...
Last week, when I had a hypo, my blood sugar level was at 2.4, and I checked it 2 hours later, and it managed to get up to 2.6.
And were you taking these tablets at that time?
No, I wasn't taking them. No. Because that's what I said. I run out of them. I ain't had them for a month.
And yet your blood sugar was low?
Yeah.
Did you feel unwell last week?
Well, I felt really ill last week.
Have you been eating?
Yeah, I've been eating.
Yeah.
I had a big fat kebab and everything. So I was all right. The next day I woke up and it was just my blood sugar level was just as low as it was.
So we have seen in research that diabetes can be 2 to 3 times higher in prevalence in those with severe mental illness compared to the general population. Patients who suffer with severe mental illness are at risk of having poorer lifestyles. They tend to have poorer nutrition, partly because they have less income to try and afford healthier foods. And some of the antipsychotics can lead to a rise in blood sugars. So it is difficult for patients with severe mental illness. Do you drink alcohol at all?
Yeah, a little bit, but not a lot.
How much is it at the moment?
I drink 5 units a week, a day. Usually it's just 2 cans of beer that I have, and that's it.
What kind of beer is that?
It's a K-cider, which is 8.5% in volume.
Okay.
Sometimes I don't drink. I go days and days and days without drinking. Where I'll just literally just drink water.
Right. So you have some alcohol-free days.
Yeah, I have plenty of alcohol-free days.
Right. Good.
I only have a drink. I have a drink when I get paid, and that's it. Okay. Once every 2 weeks.
Okay. What we will do, you're going to see your consultant, and I'd like to see you shortly after that. And then, obviously, the reason you came today, I must give you a prescription. All right?
Thank you very much.
Okay, see you soon. Okay, take care.
My daughter had an appointment at 9:30. Can I cancel that, please?
Right, now I need somebody to tell me how to cancel this, because I don't know how to do it. How do we cancel it? This lady needs to cancel her daughter's appointment.
It's going to be the easiest thing you ever do.
What did you press?
C.
Why did you press C?
Cancel.
I will get there, sorry.
Okay, have a seat. Just check your oxygen levels. That's it.
I'd rather not have a bad chest.
Yeah.
You're the person to see when you put me at ease, totally at ease.
Oh, good, good.
I mean, the last time I was feeling a bit rough, and I've come out of here feeling all right,
Oh, good.
It's one way inhale the cold.
Yes, yeah.
It seems to do me no good
It
at all.
affects your chest. You're feeling up to the breathing test today?
Yeah. Well, I dread it, but you know what I mean, don't you? Got to be done.
And you don't smoke anymore, do you, John?
No. 50 a day I used to smoke.
Gosh.
Silly, isn't it? God gave me a pair of lungs, I could run cross country, I used to box when I was in. What do? I smoke 50 a day and destroy it all.
Yeah.
Crazy,
but,
isn't it?
You know, when you were young, though, nobody knew the dangers of cigarettes, did
I
they?
watched all my favourite film stars smoking, so I thought if they're doing it, it'd be OK, wouldn't it?
And in the army, they used to give out the cigarettes, didn't they?
200 a week, I used to smoke.
The first test is the relaxed blow.
Right.
Okay, so so it's big breath in, fill your lungs as much as you can.
I'm just bracing myself for that.
Tube in mouth, pinch your nose, and then just blow out nice and slow and steady. Okay, so fill your lungs. That's it. Tube in mouth, pinch your nose. That's good. Keep going, keep going, keep going as much as you can. Squeeze it all out. Good, well done.
Was it good? I didn't think it was very good.
Well, we'll have a look at the results in the end. So the next one is the forced blow, where you blow out really hard and fast.
As long as I can, obviously.
Yeah. Okay, so it's big breath in, remember? So big breath in. Okay, really go for it, yeah?
Yeah.
That's good. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. As much as you can. Good, well done.
Was it? I thought that was rubbish. I'm doing the best I can.
Got a nice shade of scarlet when you're doing it. So we measure how much you blow out in 1 second. That was pretty much exactly the same as last year.
Yeah. Okay, good.
Your full lung capacity is better.
Really?
You blew better this year than you did last year.
Brilliant.
Last year you blew 2.96 litres. This year you blew 3.24 litres.
Brilliant.
So that's good.
When I leave here, I'm going to have a run around the block.
So you've done better than you did last year. So that's good. Okay.
Is that it?
That's it, I think. Yeah. If you do have any problems with your chest, just come in and ask for an emergency doctor's appointment, yeah?
Can I just tell you a good joke? It's perfect.
Okay.
An Essex joke.
All right, go on then.
So there's a nightclub and there's a fight in this nightclub. And this blonde comes out covered in blood. The ambulance arrived and the paramedic said, "Where are you bleeding from?" She said, "Romford."
Very good. Nice to see you, John. Take care.
See you next year.
Yeah, take care. All the best. Bye-bye.
Yes, Dr. Hyder, come through and have a seat. And how are you?
Yeah, not very well.
Not very well. How can I help you today?
Last Tuesday, I had a phone call from Wrexham Hospital that I have got gestational diabetes. And since then, I've been checking my blood sugar, which is, results are not very good. And I phoned them this morning. I left a message at 8 o'clock.
Okay.
Nobody rang me back.
Okay. And are you on any medication? Have they started you on metformin or any medication? No. Is it your first pregnancy? Okay. So they're usually a bit higher than desired, aren't they? Gestational diabetes is a type of diabetes you get in pregnancy. It's when the pancreas is not producing enough insulin for the body's demands, so you get high blood sugars. The main risk to the mother and baby is that you get macrosomia, which is when you have a baby that is much larger than an average size. And the risk to the mother is that that will then be very difficult to deliver that baby vaginally.
Like last night, I just had salad in my dinner.
Yeah.
And it was 5.2, which was normal.
Yeah.
So this morning, I don't know why did it shoot up.
Yeah. It's sometimes just related to having the problem gestational diabetes and not because of what you're eating necessarily, because the pancreas is not sufficiently working, which is why it's not lowering the sugars enough. Sometimes you need to start some medication in pregnancy for that as well, and it's usually metformin. But what we can do is try and call the nurse now so she can see you if she's answering. Yeah.
Thank you.
How many weeks pregnant are you at the moment?
30.
30. No, so it's the same again, answer machine. What I'll do is I'll speak to the obstetric doctors as well and just ask them if they want you to start on any medication. Hi, it's Dr. Hyde or GP calling. Could I speak to the on-call obstetric doctor for advice, please? Thank you.
Just take a seat there. Oh, sorry, is this Mum?
Thank you much. Oh, butterfingers.
Ow! Pinch yourself.
Yes.
Oh, bless you.
I'm gonna cry. Bye. Ow. Oh, bang me knee.
Right, how can I help?
Right, my problem is my toe. They sent me for X-ray.
Yeah.
It's come out as some arthritis. But after a whole day at work, I just find it very painful. It does hurt at night as well.
It's called hallux rigidus is what it's called. And it's a stiffness of that joint. It can be made worse by wearing heels.
I don't wear heels.
You wear flats, yeah.
Because I work in the hospital, I'm always on flats as well.
And you're always on your feet.
Yeah.
Yeah. The only solution to this is an operation. The operation itself is painful, and it's very painful afterwards. But that recovery period lasts about 6 weeks or so, after which you're left with a stiff, surgically frozen joint here, but it's not painful anymore. But you have to be willing to have that surgery. It's not something I would jump into without sufficient thought. Unfortunately, the only other things that help are icing the joint. People underestimate greatly the amount of relief that you get from icing a joint because there's inflammation in there and the ice slows that inflammation down.
Okay, is it because I'm lacking something?
I suppose it's really a relic of evolution. All of our weight bears down on our feet, and in order to walk forward, you have to spring off your foot, and that joint takes most of the strain from the spring, and that's why it happens. It doesn't happen to everyone.
I've had bloods done recently.
Yes.
My HbA1C was it?
HbA1c, yeah.
Has it gone up?
Yes, it has gone up. Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and joy. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. I know they're hard to do.
I know at work, you're working all day long and then you want to treat them.
Have an apple. Have an orange.
I do apple and fruits. I love my
okay. Okay, so that's what you have, and I'd like you to read up on it on patient.co.uk.
Thank you. So just take the naproxen and do the eyes treatment like you've recommended.
Correct.
Oh, thank you very much.
All the best.
Bye.
Yeah. Bye.
Okay, that's great. Thanks for your help. Bye. Yep, so they're not too concerned about the readings at the moment. They think that the diabetic nurse will be able to give you advice when you've done a few more readings. They would probably start you on metformin if you had around 3 readings above 7 before meals, which you haven't had. Gestational diabetes tends to disappear after delivering the baby. However, there is an increased risk of developing type 2 diabetes later on in life. OK, all right, so see what they say, and if you're still not sure, then you can phone us and speak to us on the phone as well for advice. All right, take care then. Bye-bye.
Hello.
Hello.
Nice to see you.
Yeah.
So how are you?
Oh, I'm okay.
Good. You're looking well.
Yeah.
Yeah. What do you do during your days at the moment?
Today I went to Unveiled Day Centre.
And how often do you go there?
Every Wednesday.
Every Wednesday. And what do you do the rest of the week?
On a Monday, I go recycle teenagers.
You go and recycle teenagers?
Yeah.
That sounds fantastic. How do you recycle a teenager?
Drink a lot of tea.
You drink a lot of tea?
Yeah.
Brilliant. How would you describe your health?
A lot better.
OK. Can I ask how your water works? Because in the past you've had the occasional trouble with those, haven't you?
I do wee a lot, you know.
We went on a trip last Friday and he was going to the toilet a lot.
Yeah, how about night time?
About 4 or 5 and that.
You're getting up 4 or 5 times at night?
Yeah.
That's quite a lot, isn't it?
Yeah.
Would you mind if I examine your prostate? Do you know how I do that?
Yeah, OK. Was that when you put your hand...
Do an internal examination in the back passage?
Yeah.
That's right, yeah. Is that OK if I do that?
Yeah.
It would be useful for me today to do that. Is that OK? Yeah. Would you mind popping on the couch for me then, and we'll do that for you?
Do you want me to leave the room?
It's fine if you want to stay. Are you OK for wanting to stay?
Happy to be here.
OK, but we'll draw the curtain round.
OK.
OK?
OK.
OK, do you want to lie on the couch? That's it. Swing your feet up. Bit of jelly. OK. OK. Great, that's it, we're done.
Is it done?
We're done, yep. OK, that's it. Lovely. Do you want to get yourself dressed and then come out?
Yeah.
Is that OK? So you've got a tablet for your prostate and a tablet for your bladder to try and control that. So you're on the maximum treatment already, really.
Oh, OK.
You know,
But the prostate, you think, is just...
It felt completely OK examining you, just a bit big. I think the problem is as much with the bladder being sensitive as with the prostate.
because sometimes, I mean, I know last time that, I mean, he wants to go, but it's not a lot.
Yes.
When we're out, we drink more, don't we?
Yeah, I try and cut back.
Yeah, there's always that wish, isn't there? Because you're out, yeah.
Cut back a bit, you know.
Yeah.
Well, thank you for coming.
OK.
It's nice to see you.
Thank you.
OK.
All right.
Thanks for coming. Nice to see you.
Nice to see
Take
you.
care. Bye-bye.
Bye.
See ya. You're going to be all right.
I'm going to be all right. I've survived this long. Why not carry on?
Lovely. Thank you very much, Doctor.
Bye-bye.
Sometimes if I would feel a bit depressed, I would start punching up a wall. Instead of cutting my wrist, I would do that rather, you know.
I got to the stage in life when doctors are looking young.
OK, all right.
Oh dear, sadness.
I was obviously clinically depressed, like, you know, this isn't just low times. We're talking, yeah, pretty bad.
And when you faint, you actually sort of
lose consciousness, or do you just go to the floor?
When I fainted, I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted.
Good morning, Putney Mead. Naomi speaking.
Yeah, just to let you know, it's a teaching appointment, so there's going to be a student in the room.
At the moment, there's nothing I can book in advance.
So what's your date of birth? And what's the name?
Hans, morning. Right, so what's happened in the last 10 days?
Well, I can tell you what's happened this morning. Very depressing for me. I ran upstairs to the toilet, but I had
an accident?
Yeah, an accident.
Loose or?
Yes, it's always very soft. I don't have any constipation. What I have noticed on the pan is the stuff was going not down, but up and sideways.
Right.
And it was on my cheeks too.
A bit of splatter.
Yeah, I've never had that before. March this year, I had an accident in the kitchen where, you know, luckily it was on the lino, but, you know, it's pretty disgusting, isn't it?
Right, okay, so you had all those blood tests done and kidney function's normal, thyroid's normal, liver is completely normal, kidneys again are normal. Okay, we're going to have to feel the back passage, I'm afraid, Hans.
I feel sorry for you. Would you want me to take trousers and pants?
Oh, just pull them down. You don't need to take them off.
Yeah. I do get some on the side of the pants, some hard, dark, blacky brown spots, and they're very hard to shift. I have to get a scouring pad. I can't flush them away.
Right.
They're very sticky.
Roll onto your left side.
Left side, sorry.
That's okay.
There we are.
You get a bit of itching down here, don't you? The skin's at the back is just a little bit abraded.
Well, I suppose that's because I've been rubbing it, especially this morning.
Okay, little pressure, shouldn't hurt.
Yeah. Oh.
There's certainly no blood there.
Good.
And no lumps.
No lumps. So it's not piles or hemorrhoids?
I certainly couldn't see any, and...
And there's no mess in the passage at all?
No.
Oh. It's funny, since you've done your examination, I feel I got an urge to go to the toilet again.
It's not uncommon. You may have to go, yeah. But it's not been diarrheal.
It comes out stringy, like about the size of my index fingers, curling round, you know. And then I've had soreness.
Is it itchy at the moment?
No.
No. I don't have any strong alarm bells about any of this at the moment. I think we're going to wait and see for 3 months, Hans.
Right, thank you.
I haven't got any magic medicine at the moment.
If there are any more problems, I'll come back. Thank you, Doctor.
Okay.
I woke up like this morning. Yeah, I have very bad teeth. I'm ashamed to say. There's stubs and everything. And I don't know whether that's what's done this to me.
So it's all swollen. Is it painful?
It's not that it's painful, it's just more awkward.
Okay.
You know, to try and open my mouth. And I just... I'm so upset. Is there any way I could go to a hospital and get these out? teeth out.
You can, but that your dentist would organise that.
I haven't actually registered with a dentist here.
You'll need to see it. You need to register with a dentist.
You see, I'm terrified of needles.
Don't worry, that's all right. We're here to try and help. It may be that we can give you some antibiotics. That's what we could do, really, to let it settle down while you're waiting to
How long will
register.
that take?
It probably is just a dental infection, and with antibiotics will get on top of it quite quickly. Let's have a little look at this mouth, and I'll have a look in your ears. You open up for me. Yeah, it looks like there's something quite nasty going on at the top there.
Sorry.
All right. When I did look inside this lady's mouth, it wasn't a particularly pretty sight. It was pretty appalling. Some people just have a sort of almost a phobia. It's difficult sometimes getting people to access the treatment they need. You just have to take them through it, really. What we need to do is get you started on some good broad-spectrum antibiotics to get on top of that, but that's all that we can do, really.
You see, I'm so terrified of needles, that's why I don't go to a dentist. I know it's stupid.
If they want to do anything, we'd be happy to prescribe a little bit of sedation for you to have some procedures done.
I need to be knocked out because, I mean, they're in my gums, you know.
Yeah. OK, these... You're not allergic to penicillin?
Not that I know of, no.
So this is a week's worth, 3 times a day. That should get on top of it quite quickly.
OK.
All right.
Listen, thank you
No
very
problem.
much.
It'll settle down with those antibiotics. It really should, but obviously it needs more than just antibiotics. All right. OK. All right.
Thank you very
No
much.
problem. Bye now.
Bye.
You not on any medication? Well, why have you got to have a medication review then?
Hi, oh gosh, hold on 1 minute.
Do you smoke?
I smoke a tiny bit.
And how much are you smoking at the moment? I'm a detective. Yeah.
One day when I sort of put my hand out, I had a cigar there.
Yeah.
And I thought, I don't remember lighting that.
Is it all right to ask you some questions in front of your mum? Is that all right?
Probably.
Do you smoke?
No.
No, OK, all right.
I'm Dr. Mackenzie. We spoke on the phone last week.
Yes, we did.
Same problem?
I've restarted my antidepressants after a 6, 7, 8 odd week break.
What is it you take?
This is it here, if that means anything to you.
Yeah, and what dose do you take? One of these a day?
No, I'm taking 2 of those a day.
Right, OK. Does it work?
There's highs and lows. To cut a long story short, now I'm going to start. So, I need to get onto something that's going to give me some life back because I'm not. It's not happening. I'm not enjoying. I'm not living. I'm not anything.
Good morning, Funny Mead. Rachel speaking.
We don't have anything for tonight, unfortunately. We've only got mid-morning by the look of it.
No, I don't have any today, sorry.
Okay, just bear with me, I'll have a look at it.
Unfortunately, no, not at the moment, I'm afraid.
So that's with Dr. D-Man, 5 o'clock.
Come in. Hi there, hi. Come and have a seat. So Ellie, is that right?
Yeah. Ellie was going through really dizzy spells and just feeling absolutely ghastly. And we ended up at the Cromwell because she sort of did this dramatic collapse in the waiting room and they ended up putting her in an MRI. But we ended up at an ENT specialist and he thought it was just really bad labyrinthitis. Okay. She couldn't move. And ever since then, we've had continuing episodes. Normally it's just sort of a day here and there, but this last week has been really awful. She feels so dreadful. She's just miserable.
Yeah. So do you want to just explain to me what it feels like when you...
It feels really dizzy and sometimes I feel sick and nauseous.
Have you been sick with it?
No, I haven't been sick. I just feel nauseous and really yuck.
And have you had any fever or sort of coldy type symptoms?
I get the often cough, but I don't think it's like a fever.
And is it generally, does movement generally make it worse? Yeah, so that's why lying down helps you to...
She just wants to lie and then we can't get her up.
Yeah, but then when I lie down, I can't really get up because I feel so dizzy. Yeah, I can't move.
So I'm just going to take your temperature. And any headaches at all?
Yeah, I've had a couple of headaches, like really bad ones.
Do you want to describe the headache to me?
Sometimes it feels like somebody is like ringing, you know, the church bells. It feels like I'm like right against one, and sometimes it feels like there's somebody hitting me, and it really hurts.
And when you faint, do you actually sort of lose consciousness, or do you just go to the floor?
When I fainted, and I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted.
I'm just going to ask you to follow my finger with your eyes, but keep your head still for me, okay? So, and just tell me if you see double, okay? Okay, that's fine. From what you're describing, it sounds absolutely like a sort of inner ear sort of disturbance. What we could try would be some regular Stemetil.
Does Stemetil help the dizziness or just the nausea?
Both.
Okay,
Yeah. Okay. Then if things aren't settling or worsening, then I think it would be reasonable to seek the ENT's opinion.
Sure. Can I get a referral letter from Mr.
That's fine.
Benjamin?
Yeah,
Is that all right?
That's fine, and I'll do that, and I'll leave that at the reception desk.
Sorry.
Okay.
Thanks. Thank you. Have a good day.
Okay, and you. Bye, Jenny. All right.
When did it all start not to be right?
Many years ago. Many years ago.
5, 10, 15, 20?
Triggered with children.
Yeah.
Triggered with the birth of the children.
So there was some postnatal depression?
Postnatal, definitely. I was obviously prone to it. It's depression in my family. We're clinically depressed. Like, you know, this isn't just low times. We're talking, yeah, pretty bad. Yeah.
Dramatic things?
I think so.
Suicide attempts?
Not attempts, thoughts.
Thoughts, okay, fine.
Which is a step up.
So psychiatrists you've seen?
Yeah. I've just got this deep-seated depression. I just don't know how to get out of it. I really don't. And, you know, the kids are suffering with my moods, my this, my anger, my aggression, my everything. So it's not a very nice spot to be in.
Okay, so I think
Very difficult.
the situation at the moment is certainly not to rock the boat. I think we certainly don't want you to run out of your medicines. You've had 6 weeks off.
Yeah.
And that doesn't seem to have helped. You know, so we'll give you a prescription for another month of that, and then we need to talk again. So there's enough there for 4 weeks, 2 a day, so that's the 40 milligram. So if we can meet in about 4 weeks' time. The children, boys or girls?
One of each.
Right. I want to see you before those tablets run out, so about 3 to 4 weeks up the road.
Yep.
And you can come back sooner if things were different or worse.
Okay.
Okay. Bye for now.
Bye.
It's NHS, they're up to their eyeballs with appointments for sick people.
I'm going to be doing some very basic stuff: height, weight, blood pressure. You're a gentleman who has quite a few health conditions.
Yeah.
Yeah.
But I feel perfectly fine.
Which is brilliant, and we want to keep you that way.
Yeah.
So to give you a little bit extra time with a doctor to make sure that I'm just looking at your face and you're not saying ugh, but it's to make sure.
No, well, I've got a problem straight away with that.
What's that?
This. In September, I asked for a book.
Right.
She went to her cupboard. No, I haven't got one. So she wanted to give me the other book.
Right.
Which I can't get on with.
Right.
Now, that lady could not walk next door to get one. So this is my problem when you're talking like this.
Right.
You imagine if I've been seriously ill or someone had been seriously ill and she couldn't be bothered to go next door. she shouldn't be in the job, personally. Nothing against yourself, but when you're going on about all this, and I've had an experience of that, I don't think it's very funny, like, personally.
No.
Sometimes you feel like you sort of, well, does anyone really care anymore?
Right.
Hi, Mr. Walker. Come in.
You are a very lucky man.
Why is that?
Just about ready to get away.
Were you?
I've been waiting here over an hour.
Yeah, I'm really sorry. I've just been...
No good, it's not good. Very annoyed. Carry on.
This has been going on since last December, and I've had enough.
But how long is it going to be? You know, I'm going to be dead by the time I see that.
Yeah, okay.
The service has gone downhill, personally. That's how I felt.
Yeah. Yeah.
And the only other thing I've got to think of, I'm not happy with the book.
Come in. Hi there, hi. Lost your voice. Yes. Have a seat. I'm not Trace, by the way, I don't think we met.
No, I don't think we have. So I don't know whether you've had a quick look, but it's an ongoing condition.
Okay.
So I've had 7 operations over the last 7-8 years. I've got another one due in 4 weeks. But it never usually gets as bad as this before an operation.
Would you just explain to me the history?
Yeah, so it's the HPV virus on the vocal cords. The first time it happened, they cut them away, analysed them, it's all fine. And it was quite a while before they came back. And then this year, I've had 3 operations.
Right.
So it's quite aggressive at the moment.
Yeah. And other than the sort of loss of voice, do you get other symptoms with it? Is it uncomfortable or...?
It is at the moment, because I'm having to push words out, I think.
Yeah, so it's
because when I try to talk, there's nothing coming out at all. And it's
quite exhausting.
It is.
Yeah.
And I'm having a few issues with work because I work for a university doing inquiries and I can't answer the inquiries.
You can't answer the inquiries at the moment.
No, it's just getting quite impossible, really, to carry out my job. Really, I'm just asking you whether it would be possible to be signed off until the operation.
We'll just have a look and see. Don't open your mouth up nice and wide for me. And say, oh, for me. It's not in the area that you can see, it's further down onto your vocal cord, so you can't actually see anything there. Okay, no fever or cold or cough or anything like that? No. Okay. I mean, it doesn't seem that there's much choice really if they can't bring the operation forward and work can't find anything else for you to do. It doesn't seem that it's fair for you to continue working. So I signed you off till the Monday following the operation on the Wednesday. Hope it goes all right.
Thanks. You'll be used to it by now.
How long have you been on the HRT for now?
2 years.
Okay.
Yeah, 2 years.
And what symptoms did you have before you went on it? What was the reason?
Well, I went to my gynae, who
Right.
I see every year. He's known me since he produced my last child, who's 23 years ago.
Okay, all right.
And his expression was that I'd hit the buffers in my life.
Okay.
And he said, I've got some magic potion for you.
Right, okay.
And this was it, and then indeed it has been magic.
Okay.
You know, he put me on this and I haven't looked back.
Are you having any periods at all?
No.
No. And
Thank God. Those days are over.
Oh, right. And what did he explain in terms of the risks and benefits of...
Lots. He explained everything. I do have mammograms.
And they've been normal?
They've been normal.
Can I do your blood pressure? May I do that?
Oh, crikey. Yes, I'm just about to play tennis and
Right.
all sorts of things. And...
When you're on HRT, we need to be keeping a close eye on your blood pressure as well.
Do you? Oh, okay. I didn't realise.
So, nice slow breaths and then we'll... Okay. It's not very high, but it's certainly not kind of in the low in your boots.
All right, okay.
But I think given that you're on HRT
Yes,
and we need to keep an eye on it.
yes,
I guess the question then to ask is how long do you foresee taking this for?
I'm not a drug taker.
No.
Do you know what I mean? I don't pop pills unnecessarily. So, I mean, it's just, I know it's there. It's my little crutch.
It's your crutch.
Yeah.
Okay. Well, can I suggest if I can give you 3 months this time round,
Okay.
and then we could have a follow-up discussion about that, so making a plan.
Okay.
Is that okay?
Yeah, perfect. I've got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
Well, nice to meet you.
And you.
And then we'll touch base, as I said, in about a month's time.
Oh, yeah, all right.
Have a nice
Nice
day.
to meet you.
All right,
Bye.
bye-bye now.
Oh, a pink sticker. Have you had a flu jab? Very good.
And how are you feeling since all the events with all the bleeding?
I'm really lucky to be alive. What happened is I was driving
Yes.
to play golf, and from York to Chester.
Yes.
And I decided to fill up with petrol at the last petrol station just outside Chester. I know it very well. And I got out of the car. I filled the car up with petrol, and I felt a bit giddy. And I thought, oh, fumes from the. Went in to pay the bill, and that was the last I remember. Next thing, I was in an ambulance being rushed to the Countess of Chester Hospital.
This happened in the morning, and by the time we got there, which was about 5:30 in the evening, he was drifting away, he was fading away.
Goodness.
And he was still bleeding,
Right.
purging blood,
Yes.
and they were pumping blood into him. And we were told by one of the doctors that some people stop bleeding and some people don't.
Put 6 pints in.
6 pints of blood.
6 pints.
His temperature had dropped to 60-something over 20-something. And he was drifting away, so I held his hand. I told him to keep awake, stay awake, stay awake.
And had you had any symptoms before any of this?
None at all.
So no pains?
No pain or anything.
Nothing like that?
Quite extraordinary.
Well, it is. I don't know. You've been very lucky, I think.
Have I?
Yes, because I think it sounds like it was a very scary episode up in
It
Chester.
was.
Terrible, terrible. We almost lost him.
I wake up in the night because I just can't get any air into my lungs.
So big deep breath in, and then blast your air into there. 1, 2, 3, and keep blowing, keep blowing, keep blowing. Keep blowing, keep blowing, keep blowing. Stop when you need to. Well done.
With hindsight, it's easy.
Yes.
The only indication I had that there was something wrong is that morning before leaving Yorkshire, I had to sit on the loo, and I thought I had diarrhoea because I was on the loo for a very, very long time, and without being too vulgar, I virtually filled the loo. And I thought, this is diarrhea. I didn't realise it was black blood.
Was it black?
He didn't tell. He didn't.
But I didn't, I didn't think about it.
No. Shall I have a look at this wound?
Yes. Sorry.
That's all right.
The nurse is coming to take the rest of the staples out tomorrow morning. She's a fantastic nurse.
So they took out the whole of the tumour?
The whole of the tumour.
It's all out?
They had to take the spleen out as well.
Yeah, they took out
Yes.
the surrounding tissue.
That's right. I don't want to take this off because I think it's well dressed, but I can see around there it looks still a bit moist, but this end is healing nicely.
I'm on penicillin
now
for the rest of my life.
So it's going to be lifelong, yes. Once it's all settled, there's no reason you can't carry on doing things as normal.
Right.
I think you just have to have a period where you're just convalescing.
The other thing we don't know, we haven't had the results of the biopsy.
No.
On the tumour as to whether it was, benign or.
How are you feeling about it all?
Fine.
Are you?
Determined to get back fit, look after my wife. She's a very good nurse,
yes, she is.
but I need to look after her.
Yes.
So.
Right, good. I would suggest we touch base once you've seen the Marsden. Okay.
How can I help today?
I came from France and I forgot my drugs.
So you're just visiting here?
Yeah, I'm just visiting. I'm a sort of temporary patient, and I forgot those 3 drugs. There's a statin and the aspirin, and then there's a blood thinner, but I don't know which is which.
Okay. Can we check your blood pressure now that I've got you in here? Are you just over here seeing family?
No, I have to see to get a new passport. My wife just died, and so
I'm sorry.
I need to get back to America. She was American, and uterine cancer. Yeah, and so it's sorting out affairs and doing stuff. And I come over for a sort of a health check, but I'm sorry, this is unscheduled, you know.
Now, while we're doing, let me do this again. Be nice and quiet for a moment just while we check this.
Oh, okay. Is it high?
It's probably because we're talking, so.
I had it checked about 2 weeks ago.
Now we're talking again and it's gone up, so nice and quiet. Sit back in the chair and no chattering.
All right.
So your blood pressure's 146/94, which is a bit higher than I'd like it. So just when you get back to France, get it checked again.
Oh, okay.
But let's give you these medications. So aspirin, Tenolol, and then there is Suvastatin, one to be taken at night. Okay, it actually says on here, Le Soir.
Le Soir, yes, it does. That's your actual French.
I remember something from my GCSE days.
Yeah, well,
All
I
right.
didn't even look at that.
And don't take it with grapefruit. That's another one. Don't ever have grapefruit with your statin. It increases the risk of you having side effects like muscle aches and pains and inflammation of the
I have
muscles.
a grapefruit every day.
Oh, I probably would
In
avoid
the morning.
it.
I don't sort of have a spoon or cut it. I eat it like an animal over the sink, so very quickly.
Well,
Before I have
recommend
my
not having-
porridge and fruit and
Not
stuff.
having grapefruit.
Oh, really?
Yeah.
It's bad for the condition, is it?
Bad for the statins because it increases the risk of getting inflammation of the muscles.
So that's a statin, is it?
Yeah, that
Well,
one's
I
the
take it. I have a grapefruit in the morning, so the statin at night would be okay, would it?
I mean, the recommendations are that you don't have grapefruits.
All right. Well, I'll take that on board. Thank you.
Okay.
That's great. You've been great. Thank you very much.
No problem.
Thank you.
Don't forget your wallet.
Bye.
I'm going to take it as a tip.
Thank you. Bye.
See you later.
Is it itchy? No. Is it very tender to touch?
Yes.
Can you just twist the top half of your body and just go right round and then the other way?
So you've come for your blood test for your blood sugars. Just relax the hand.
Hello there. Nice to see you. Have a seat. Now, we've called you in for a global health assessment, I think, is something...
Well, yeah, I had to have a blood test.
Well, your blood pressure is certainly perfect. Your cholesterol is brilliant, so the tablets there are working very well. Kidney function's a little bit reduced from normal, but it's very stable. How have you been feeling in yourself?
Not all that, to be quite honest with you.
Mm.
Not all that. My legs play me up.
Mm.
And I do get a pain in the right-hand side here.
Yeah, that's to do with that arterial disease that we know you have. Do you mind if we just check your hips and legs out, if you pop in behind the curtain there for me? Just lie up on the couch and tell me about the dreaded cigarettes.
To be quite honest with you, I started again.
Right, well, that's a little bit of a problem. We know the circulation in your legs is not great. There's a bit of a pulsation here, and certainly none further down. I'm just going to rotate your hip a little bit. Just tell me if it's painful. Okay, well, they're both a little bit stiff, but the problem is still that circulation in your feet. Up you come. I think there's a good reason for asking a blood vessel specialist to have a look at you. I'll arrange a referral up at Queen Mary's, and we'll get that done fairly quickly. Date of birth is 1st of May, 32.
That's it, yeah. 82 years of age.
So during the last month, do you feel down or hopeless, depressed?
Yeah.
Frustrated?
Yeah. Yeah.
How big a problem does that get?
I just have to get on with it, don't I? You know, I used to go to my daughter's in Sussex, but I don't go now. But she phones me regularly.
Right. Does she come up here at all to see you?
Oh, yeah, yeah, but not like she used to.
No.
And I used to go down there quite a lot. but I feel I don't want to go now.
Yeah. And friends? Do you have any friends left of your age around?
No, not really, no. A few of the neighbours I get on with.
Yeah.
But other than that, no. Don't have no friends.
It strikes me that your legs are a big part of interfering with your life and making you a bit depressed, really. And if we get Queen Mary's to do an assessment, and I think that if we can make your legs better, I think it'll make a big difference to you.
Yeah.
Hi, all right. Come
Yeah,
in, have
good,
a seat.
thanks.
Is it Wesley Stone?
Yeah.
Hi.
I'm going to South Africa for 3 weeks for holiday.
Yeah.
Yeah, so I just wanted to get a prescription for my paroxetine and Lamictal.
So you take it for the bipolar, is that right?
Yeah, well, I was diagnosed with bipolar when I was, 16 or 17, but I was taking a lot of drugs at the time. So, I mean, I've been clean now for four years.
That's
no,
great.
longer, 5
Yeah.
years.
Yeah.
I gave up drinking 2 years ago, so I don't even drink. I used to get very aggressive for no reason before,
Yeah.
Sometimes if I would feel a bit depressed, I would go and start punching up a wall, and then my knuckles would be all smashed for a couple of weeks. And so instead of cutting my wrists, I would do that rather,
But we're not,
Yeah, but that's...
things are a lot better, aren't they?
Yeah, that doesn't even happen,
Okay.
So.
At the moment, are you feeling suicidal or like hurting yourself?
No.
No. Okay, well that's good. And it sounds like you've taken away a lot of the factors that were causing your mood swings, and that as a result of that, it's become quite stable. Is that fair to say?
There's absolutely nothing wrong with him now. He never gets angry. He probably doesn't even need the tablets anymore because he's perfectly fine.
So we're in a better place, aren't you?
Yeah.
Have you ever seen a psychiatrist in England?
No, because I haven't really felt I needed to,
Yeah.
And that's the whole reason I changed my lifestyle over the last 5-6 years,
Yeah, and you've done a great job with that.
Yeah.
From what you're telling me.
Yeah.
So shall I give you the medications as you normally take them?
Yeah.
And maybe you can come back and see me after South Africa.
Yeah, that will be
and
good.
And we can make a proper go at reducing these medications. Getting the psychiatrist involved when we need to. Does that sound all right to you?
Yeah, that would be good. Yeah.
See when we've got some appointments available when you come back, and we'll take it from there.
And then, yeah.
All right.
So I'll see you then. Eh?
Yeah. All right. Take care. See you later.
Bye.
All right. Bye now. Bye.
Good morning, Putney Mead Care speaking. How can I help you? Okay, hello?
There is. No, you're right.
She hanged up the phone.
Hi there. Hi. Mrs. and Miss Doyle. It's Miss Doyle we've come to see today.
That's right.
Right, this arm. Presumably.
Yes.
Still hasn't really gone down, but it's getting better.
I think it is getting better, isn't it?
The only reason we're
But
back...
it's very slow.
Yes, and it still feels quite hard underneath.
Yeah. Maybe that's 18 millimetres by 18 and a half. I said 20 by 20 last time, so I think this is settling down.
Do you?
It takes a long time, but it is a frustratingly long
Well, I'm
period of
happy
time.
if it's going. We're happy if it's going. I think she's had so many antibiotics. Don't really want her to have another course because she's had so many in the last.
Well, for this, I've had it for my ear.
Has come back with her mother, full stop. The area of inflammation is reducing. It now measures 18 by 18 millimetres, full stop. There is no fluctuance, so nothing to cut into, full stop. They are to return in 2 months if it has not fully resolved, full stop.
Because she's getting quite a few skin things, do you think some children are just predisposed to? Because you've got molluscums and...
I think her immune system's trying to keep it under control.
Good.
But lots of people need a little bit of help.
So we just paint the stuff on, do we, and then it zaps it?
Cross fingers, yes.
Touch wood.
Touch wood, yeah, absolutely. That is the instruction. Okay.
Thank you, and thanks for seeing us today. Thanks very much. Thank you.
Bye.
Bye for now.
There's no hurry. Oh. There you go. Come and have a seat.
Thank you.
Oh. You're doing a bit of falling around the place. You've had about 4 falls by the sound of it.
And in fact, last weekend I had to take her to the emergency, Princess Grace, because her ankle was all swollen and her leg was bright red. So I rushed her up to the Princess Grace and they'd given her a course of antibiotics because it got infected.
And is it better?
It's getting better. We've been coming here to have the dressing changed.
Yeah.
I have blackouts.
Yes.
But
And
the
they're
last
very
one wasn't a
painful.
blackout. I think she just lost her balance.
Yeah.
I've actually watched her and she sort of loses, does that, and I think it's
Okay.
just a question of not having balance and
You
strength.
may be absolutely right.
Strength in
But
her.
it's funny that she sort of blacked out. Is that...
Well,
It doesn't tell me I'm going to black out. It just blacks out.
I know. So maybe going to the Falls Clinic
Yes.
might actually be a sensible move.
I haven't got much longer, have I?
You've got a lot longer.
Well, the thing is, you can't depart
No.
from this earth by appointment.
No, that is
You have to do it.
absolutely true.
You have to do it when your
Yes.
cards are up.
That's right.
So what we want to do is try and stop you falling over a bit so that you don't break anything.
If you
I
could
mean, that
tell
would be
me.
that would be the worst thing you could do to break something and find
Yes.
yourself in hospital.
Yes.
She's got a care team starting next week who are coming twice a day and are going to take her out for walks and
Good.
give her a bit more confidence.
And that's helpful to you.
Very, very helpful because I'm completely exhausted. Her mind is getting quite bad.
Yeah.
Her confusion is very bad. Isn't it, Mummy? You get very confused.
But I'm very old. I'm 91. I mean, what else can I?
You remember
Well, this is why your daughter's organised for people to come in and keep an eye on you, and
Yes,
Yeah.
which I think is very sensible. You know, your daughter's
well, I
your
never
daughter's
had to.
coming over, and she needs a bit of help. Otherwise, if she gets overtired,
Yes,
of course.
then it's not going to help.
I'm not
her.
a young woman anymore, unfortunately.
No, you think she's still a spring chicken, but she's
40 something.
No,
That's a young.
No, I'm 65,
Oh,
Mummy.
really?
Yes.
That's the problem, is that we're all getting a bit older.
What can I do for you
It's
today?
only a stupid thing. My toes got infected.
So that's an infected and growing toenail,
Oh,
I
is it?
think.
Can we keep the toe?
You can keep the toe.
And about 10 days ago, I had athlete's foot. Now I'm faced with intense burning and intense irritation.
It's hot. My feet are hot.
So it's like burning like fire.
Mainly under my toes.
You've got quite a lot of breaks in the skin. This may be a little bit of residual infection. That's a little verruca. Don't worry. Does it hurt you? No. This swelling you were pointing out?
Round there.
Yeah.
There.
Okay, okay. So,
Oh, I'm sorry, I've given you the wrong foot.
Hello. Peter, hello there. Have a seat. Just trying to see when I saw you last. I think it was about 10 years ago. We've spoken on the phone since then, but obviously something fairly dramatic's happened. When did they formally tell you that it was lung cancer?
About a month ago.
I think you'd had a scan that was pretty suspicious.
I've had a scan, I've had biopsy.
Right.
It's a lot. I got fed up with it.
Right.
Really fed up with it.
Yeah.
Well, like chemotherapy, I didn't want to go through it. I refuse it because I think they turn you into a zombie.
Obviously, without treatment or intervention, it's going to get worse.
Yeah.
The specialists wouldn't impose treatment on you that they thought had no chance of helping in some way.
I haven't heard of anybody having chemotherapy and all the rest of that survived. They all died.
Mm-hmm.
And even if they operate, there's no guarantee either.
No, no one can. If people promised you that it would be okay, they'd be lying. So
I won't believe them.
Who's the consultant that you've been under?
Dr. Poppet.
So have you seen Dr. Poppet?
No.
No. Is there an appointment?
On Monday.
I can't see any use of seeing him.
It would help me a lot.
Would it?
Yeah.
Oh, well,
Because it's got to be a balance of the benefits against the negative effects. You know, if those side effects were short term, but we're going to give you another 3 years.
The side effects can make you vomit, lose your hair, diarrhea, and many other things.
Yeah.
I mean, I don't want to go through all that.
Well, you know, I can't make that decision for you, but I think that you shouldn't make that decision without having the input of a cancer specialist. You know, you're sticking your head in the sand a bit. The most challenging patients in general practice, I think, and those that generate the most emotion are situations where you can't make much difference to their outcome. By and large, though, the overwhelming emotion seen is of strength and courage. You've got the power, not me and not him. You know, it's your decision at the end of the day. But I think that we shouldn't make it without all of the right information.
If that's all it is, okay, I'll go and see him.
The pain, you don't need any painkillers?
All I use is Anadin.
You got right. A lot of prescribable medicines, but I think we'll wait and see what Monday brings. Okay?
Thank you.
Peter?
Yeah.
So it's been a long time, but I think we'll be seeing each other fairly frequently.
Are all doctors healthy as well?
No.
Thanks
Okay.
a lot, Doctor.
Yeah. Okay. Thanks. Bye.
Hope you're feeling better soon. Thank you. Okay. Cheers now. Bye-bye.
Well, good luck with your Spider-Manning, all right? You're going to sort all the baddies out. See you later.
Thank you very much.
Bye.
See you again.
Thank you very much. Bye-bye.
Morning, Guildford Health Centre. How can I help? You had this sort of tightening of the foreskin. Can you retract it back to go for a wee or anything like that?
Not at all.
See, I'd say they look like bites. Any idea from what?
You know, where do we go as a family to try and get him the help and support he needs?
Are you normally generally fit and well?
No, I'm bulimic.
Hurt there?
Yes.
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing something.
I actually found her in the hallway of the house. She was still alive, but only just, and she died 3 hours later in hospital.
morning, Holford Health Centre. Sally speaking.
John Ferguson, please. Hello.
Hello there.
Come and have a seat.
Right, good morning to you.
Good morning.
On Saturday, I went to the loo and had to strain to produce any stools, as it were. And when I got up, I noticed there was quite a lot of blood in the bowl of the loo. But since then, my stools have been quite loose and I've been able to go to the loo normally. And there's no blood in the bowl, but when I touch it with the toilet tissue, there's still a witness of blood. My ex-wife has been a nurse for 40-odd years, so I phoned her up and she said, well, that sounds like a hemorrhoid.
Any history of any bowel problems in the family at all?
No, not at all.
Pop yourself on the bed. I'm going to feel your belly and then I'm going to feel in your bum.
Holford Health Centre, Sally speaking. Yeah, what's your date of birth, please? 14th of March, 1974. And what's your name, sir? Oh, sorry, I'm giving you 20 years there. That's not very good, is it? God, 43, that wouldn't put you out. That's not very good, is it? Exactly.
I'm Dr. Graham. I think we have met before.
Yes.
Yeah?
Got
How
the
can
same
I help?
first name. Well, in a playful way, my cat whacked my eye.
Right.
And it's been really painful.
You're a bit swollen up all over your cheek, really, aren't you?
Yeah, like here, here.
Yeah.
Oh, there.
OK, is it getting worse?
Yeah.
Yeah, OK. Do you feel... Yeah.
It's sort of puffing up into my vision, so...
Yeah. Let me just have a feel here. Yeah. New bit swollen there. OK. All right, let's just look at the eye area. OK. Close your eye. OK. I think what's happened is that when you were scratched, it's maybe if some bugs have got in under the skin and it's a little bit infected. So that is called a cellulitis, OK? So I think we should give you a short course of antibiotics. And you're not allergic to anything as far as you know?
No.
No.
Why is there a picture of Henry VIII in here?
Good question.
Because he's a bit of a bastard, really.
That picture was done by Holbein, but it was copied by my great-aunt. So I know who the artist was. She has died since then.
He was like, I'm going to kill loads of women.
There you go. OK, Anna?
Thank you very much, Anna.
Pleasure. Bye-bye.
Bye.
Big breath in. Point your bum at me and then draw your knees up. The key is to try and remain as relaxed as you possibly can. And the way to do that, I always say to patients, they laugh, but the way to do that is to open your mouth and breathe gently in and out through your mouth. This shouldn't hurt. Relax. And just... No, keep, that's right, that's right. No, I can't feel anything I missed there. Just stay there. You can pop this, when you're ready, get your breath back and then get yourself dressed. Sit yourself down. So what this is all about, I have to tell you,
OK.
is the possibility that this might be a cancer being there, not anything else. And the figure that they've chosen is if you go on bleeding for over several weeks.
All right, well, no, it stopped. Now I've been able to go to the loo and it's not bleeding at all. So.
Well, that's very good. So, yes, I agree with your sister.
My ex-wife.
Your ex-wife. Sorry.
No, don't worry.
So that's likely to be a hemorrhoid inside that's bleeding a little bit. If you get a bit of bleeding after you've done the poo.
No.
After you've defecated, and then you're wiping yourself as you see blood on the paper, that's very likely to be a hemorrhoid.
OK, well, that's what's happening.
Right. Otherwise, I couldn't find anything abnormal at all.
OK. Good.
So I'm sure the right thing is to wait and see.
Okay.
How are you?
I'm so.
You've had lots of contact with your psychiatrist, haven't you? And I've had some with Vicky and...
I want to talk about that first of all. Hello, they had internal meetings, which I wasn't part of. I'm frustrated that they just don't seem to listen to me. Nobody is addressing the issues of what keeps me in the traumatic circle. Trauma, and it's me trying to grab things that are there, like the sanctuary, like women's groups, things like that, and try and focus on moving forward. But my symptoms, my trauma, my flashbacks, my nightmares, my insecurities, my depression, my anxieties, this has not gone away.
So you've just got the 2 spots now, have you? Nothing else?
Yeah, this one's only small.
To be honest, has got a rash on his right leg. My arm has got, like, real bad.
Right, OK.
So, concern is, it was a mole and now it's changed.
So an itchy patch?
Yeah.
Yeah. Oh, yes, just here.
Yeah.
Yeah.
Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for
Not
a
at
wee
all.
or anything like
Not
that?
at all. There's no retraction at all.
Mm-hmm.
And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out
Yeah,
in a... does it spray at
yeah.
all, or...?
Yeah.
Okay, okay. And is there any skin change on the tip of the penis that you can see?
There's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah, yeah, okay.
Hi, Glenn, it's Rose. Hello, I don't know what I've done, but my screen has completely turned around.
Let me just try and see what they're trying to do about it. Say that you feel down and persecuted. So many different services, it's difficult to keep track of who does what and what you can expect. They also think that your expectations of services may be unrealistic.
Only expectations I have of services if somebody is offering me something that it actually happens.
Yeah.
Because it's not happened. It's not happened. Okay, now I want to talk a little bit about the gender situation. Okay, I'm going back to Laurel's. Right, I was told last time I had to wait 2 years to put the application in for the gender recognition certificate. So it's 2 years come now. But when I have to talk to both my psychiatrist there and you, because to go before the panel, I need my GP and I need the psychiatrist agreement letter. Are you happy to do that?
I think you should talk to the Laurels first and go because they will obviously know much more about that than me. But if they're saying that the situation is right for you, then yes, I will be able to confirm that.
The second thing, I'm in the position to go forward for surgery, for breast surgery, yeah. But the surgeon that I had the consultation with.
But you've had a consultation.
I've had one consultation. Okay. She's now sent me away with 2 things that she will require from me. You know, I'm working on my weight loss anyway, and I'm consistently working on that. So that's part 1 thing. Good. And obviously the second thing would be my GP to say that they're happy for me to go ahead.
I don't see any problems with this, Valentine. Okay, all right? So speak to the Laurels about both those things. Okay, so we've got a plan there, all right?
Yeah, okay.
Okay,
Okay.
all right. Okay,
Thank you.
bye-bye now.
Okay,
Bye-bye.
Yeah, bye.
What have they done? You did, it went off like that, and then it... Ah, well done. Thanks, Glenn.
So, sorry, Jeffrey, I just need to... Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there, though,
Yeah.
isn't there? Yeah, fine, OK. And let you pop your things on and get dressed. That's OK. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis erotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's obviously it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was
So
freely available.
we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you
gave
off
up.
for life.
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.
Hello, reception. Hello, all right. Yeah.
Thank you very much.
Yeah.
Thank you, darling. See you later.
Okay, I've added it on for a phone call, but it can be any time between now and when we close. All right. Thank you. Bye.
And what's brought you here today?
So she has, I can only describe it as a rash on the back of her neck.
Okay.
Which is a lot more fierce and flared than any that we've had before.
Right, okay.
But we don't know what they are, and we can't work out why she keeps getting them.
Okay, and has she been well in herself?
She's
last
well in
few
any
weeks?
other aspect.
Right, okay.
Looks like might be our animals, our 2 cats.
You got 2 cats, have you? Okay.
Put them, Bubs.
And do they get regularly treated?
Yeah, this is the thing. At one point, I was getting to the point where I was hoovering mattresses and...
And have you actually treated the house as well?
Yeah, I've sprayed the house.
Let's have a little look at your neck.
Stand up then, sweet. So that's the worst I've ever seen them.
How do you sleep? Are you in a duvet?
Duvet.
And do you have
you wrap yourself up in those little woolen blanket things?
A night dress? Or?
No, she's been sleeping in her vest and underwear.
Vest and
recently.
underwear, okay. See, I'd say they look like bites.
Okay. Any idea from what?
Could be flea bites. That's what it looks like to me.
Because I've literally stripped everything. I pulled everything out with a ream and hoovered the lot, sprayed the lot, and then the cats are defleed every 4 to 6 weeks.
The only way we can do it is, again, suggest treating the house and maybe this blanket as well, really.
Is there anything that I can do to make that go
To
down?
stop it itching, she could take an antihistamine.
OK, well, we've got that at home, so that's all right. Right, we're stripping your bed, we're boiler washing everything, we're spraying the hell out of your room. Everything that lives in your room is dead by the end of it. See, cats, bad idea. Bloody things.
Hello, I'm Dr. Bolam. Right. So, how are you?
I'm good.
Yeah. So tell me what's going on. You weren't living at home, were you?
No.
Is that right? Just tell me a little bit about that.
I used to live in care, and I was with a carer since the age of 8.
Okay.
So then I decided to tell my social worker that I would either run away or you could put me where I want to be. So I ran away from Cornwall and legged it all the way up to Bristol. But I didn't tell my family where I was for like a whole week until
Where were you?
House hopping.
Okay. So what's happening now then? What, social services know where you are.
Yeah, I'm living with Mum at the moment.
Okay. So what can I do for you today?
I have ADHD, and I take 80 grams of methylphenidate hydrochloride every day.
Okay.
And sometimes it feels like my emotions get locked away in my head, like no emotion will come out sometimes.
Let me get this straight. Are you here today to discuss this, to potentially change it?
Yeah.
Right. Okay. We need to
Why
think
were
about
you
that.
told to come here though, Leanne?
Because I took an overdose on my meds.
How many did you take?
I took 10 of the 5 milligram ones. So it wasn't like my normal high dosage, but I hadn't had anything for a couple of weeks with my meds.
Okay.
And then I had loads of them.
Okay. Let me get it straight. You've been off it altogether for a couple of weeks?
Yeah.
Because you'd run out?
No, just because I didn't...
Just didn't want to take it?
Didn't
so
take
for
it.
like 2 weeks you'd had no methylphenidate at all?
Yeah.
And then you took 10 5 milligram ones?
Yep.
So that was 50 milligrams?
Yep.
And what you told me a minute ago was quite often you take more than 50 milligrams in a day anyway. OK, this needs sort of straightening out, OK? All right. I want to see if I've got a letter from your community paediatrician, OK?
Yep.
So what they write is that you should take 50 in the mornings and then occasionally you take a 5. What they're saying is in the context of you needing to kind of concentrate.
Yeah.
OK, that's what they say. Now, if you're talking about feeling like you've taken too much, maybe that's the solution.
Yeah.
You take 50 in the morning.
Yeah.
And then you just use these if you... I mean, you're not doing homework now.
No.
Maybe you don't take these at the moment.
Yeah.
Do you need some counselling? Are you under thinking aloud? Do you know what thinking aloud is?
Don't know.
Shall I write that down for you?
Yeah.
OK, it's support for all children in care, all right?
Yeah.
But I would think they should be aware of you. They should be aware of all children who are looked after, which is the sort of fancy name for being in care. OK. And you're feeling a bit better now?
Yeah.
Is that all right?
Yeah.
OK. It's nice to meet you. So do you think you're going to be staying in Bristol then?
Hopefully, yes.
OK, good.
Yeah.
Excuse me. Excuse me. There's no phones in here, my sweetheart.
David Parfitt, please. Hello there.
Good afternoon.
Sorry about the wait. Come on
that's
through.
okay.
Come on in. Come and take a seat.
Thank you.
I'm Dr. Ahmed. We haven't met before, I don't think.
don't believe we have.
No. How can I help?
Well, here's the thing. My mum died last week.
Oh.
And I've got 50-odd years of stuff to sort out.
Was that an expected death, or...?
No, it was... Well, she was 81 and had been suffering, but, you know, it wasn't really expected. I actually found her in the hallway of the house,
She was still alive, but only just, and she died 3 hours later in hospital.
And where are the pains?
So, I mean, it's still like my legs still feel a bit tingly on occasion.
I've got problems with my knees.
Both of them?
Yeah.
I've had sort of on and off pains in my big toe joint.
This knee's been playing up a lot lately.
It's more when I bend over.
Any numbness or tingling?
No, I've just got pain right down to the fingers.
I don't think I've met you before.
No, I'm
William. Hi.
Happy, obviously.
OK, so what are we doing today?
I went to the hospital weekend, Monday, wasn't it, with the arthritis.
Woke up with terrible pains in her arm, as
Right.
per usual.
Yeah.
Went to A&E for 7 o'clock. As soon as they opened, we like to get there on time. And the usual thing, I mean, Grace keeps thinking they're going to do something drastic, but,
Yeah.
you know, because once she had a
knee
morphine
terrible,
injection in the leg.
Yes.
And I think she thinks that they're going to do that every time.
Yeah.
So what they did was give her extra strong painkillers.
Oh, yeah.
Oh, yeah.
So
And she asked me that she was letting you know, isn't it? Oh, that's one, isn't it?
Yeah.
Some codeine.
Codeine,
OK.
just to say double strength or something.
So you're affected in lots of bits of your body, aren't you?
Yeah.
Got to learn to slow down. Because as
Which
soon
I
as she
have
has a good day,
Yeah.
she's out in the garden and she'll move and pull things about.
But I guess you've got to do what you've got to do, haven't you?
Forget.
Yeah.
You're OK
Yeah.
today, you're doing
Yeah.
it, washing big out.
So, show me, with your hand, show me which bits are really sore.
Well, what can I say all round here?
That joint, so
And
that
which?
bottom bit there, yeah?
Yeah, oh yeah.
These bits here.
Yeah. And the other one was the elbow and that.
Right.
Sorry, started
Yeah.
from the elbow and went
Yeah.
right to here, and then all
Yeah.
of a sudden.
I mean, the
tap
most
hand.
likely is that this is the sort of arthritis caused by sort of wear and tear, osteoarthritis. But it is you are quite bulky here, and it is quite tender.
You didn't I look at that bit?
And your
My
wrist
eyes
is
are going
quite
this way.
swollen, yeah? Does that hurt there?
Yes.
Yeah.
it does.
I'm wondering whether we might do some different bloods, actually, just to make sure we're not missing a different sort of arthritis, OK? Which might need a slightly different sort of treatment.
Right.
OK?
Grace is thought to have osteoarthritis, but when she came to see me, her wrist seemed a little bit unusual for that condition, in that it was swollen and red and tender. And so I thought I ought to rule out an alternative diagnosis like rheumatoid arthritis.
So if you have the bloods done at some point, maybe in a couple of weeks, and then book to see me a week after and we'll discuss the results, I'll give you some of these with paracetamol in, and we'll see how you are.
Osteoarthritis is the commonest form of arthritis. It normally affects the large joints, such as knees and hips. Rheumatoid arthritis affects the small joints of the hand as well as larger joints. The main difference between the two arthritises is that rheumatoid arthritis unfortunately destroys the joint, so it's important to make the diagnosis early so that you can be on medication to prevent that from happening.
There we go, that's gone through to next door.
Right, that's
OK?
super, yes.
All right, there we go, you
We
take
go
that
through
back.
and
Do you want to put that back in there?
Yep.
In your handbag.
And that's for you to make an appointment to have the bloods done and see me afterwards, OK?
Right. Okie dokie,
Excellent.
that's fine.
All right?
Yes.
Yeah, go ahead.
Dr.
Bolan?
Boma, is it Boma?
Dr. Bolan, yeah?
Is it Bolam?
Yes. Is that who you
The
just
lady
see?
I just saw, yeah.
Let's have a look. What's your date of birth?
16th of July, 1957. 57.
Sorry, 16th of July, 19...
Don't say it loud.
Oh, sorry.
My mum died last week.
I'm sorry.
Yeah.
That's quite a shock for you, isn't it? If you
Yeah, and I kind of...
just popped round to see her, presumably, or...
I had a weird feeling. That was the thing. I'd spoken to her the night before, and she was a little bit out of breath. And she was clearly a little bit confused. I don't know. I tried ringing her in the morning, and she didn't answer. That's not unusual because she's out feeding the birds or shopping or a very active person. Tried her again after lunch, didn't answer, and I thought, that's unlike her. And I just had this horrible feeling. I don't know, I can't really explain it. It's just one of those...
Sixth sense.
Yeah. So I went there and I was so glad I did, because she was still alive, albeit breathing very shallowly, that's such a word. Yeah, she's, you know, unfortunately, she died in resus in casualty.
And have you, what I find is that you, when you're busy with it all, it's okay, and then sometimes after things settle, it hits you what's happened. Because there are moments that you feel absolutely fine because you're busy, then you feel guilty about feeling fine, then you feel sad, then you know, so it's a whole mixture of emotions.
Yeah.
And I think it's a normal pattern.
Yeah, I'm going through the what if sometimes. I think, oh, what if I'd gone round there that night?
Yeah,
she was clearly in trouble, and I didn't pick up on that.
You couldn't have changed anything. We've all got our time, haven't we? We're all here for a limited time. That's the only certainty, actually.
Yeah,
so,
that's very true.
You know, and actually you acted on an instinct there anyway to go around in the first place. So you got that last bit there.
I was glad I was with her, let's put it that way.
Yeah, that's right. That's right.
Yeah.
So, I mean, the whole sort of bereavement reaction's quite a process, really.
Yeah.
But come and talk to us about it.
Okay.
We also advise, I mean, and it's entirely up to you, but you can always contact Cruise, which is a bereavement counselling service.
Oh, okay, I didn't know that.
I'll give you their phone number. Sometimes it's helpful to talk to an objective person who's not friends or family.
Okay, that's brilliant, thank you.
Yeah.
Thank you very much.
That's all right.
Right.
Take care.
Okay, thank you. Thanks very much.
Bye-bye.
Bye.
Bye-bye now.
Bye. Oh, is somebody making coffee?
I don't drink tea or coffee, so...
I know that's a terribly good excuse. I don't know how to boil an egg, I never eat them. I don't know how to cook meat, I never eat it. That would be all right, wouldn't it? That would strike a rather high moral tone, that one.
Laura Smith. Hiya. Come in. Have a seat. All right. Right, how can I help you?
Okay, so recently, well, over the last month or so, every now and then I get this horrendous pain. Like, I don't know where it is, but it's more like here, and I can't tell whether it's in the front or in my back. And if I'm quite honest, I got a query of what it is, and this is only because my mum said she had it. She thinks it's gallstones. Because my mum had gallstones, and she had to have, when she was my age, and she had to have her gallbladder removed.
Okay.
But I never told her about these pains, and my mum's saying you've got to go and get it looked.
When did this all first start, then?
About a month ago. I would almost say it's constant because I'm getting like a dull ache in between now, between the attacks. I can feel something's hurting me.
So it's happening every day now?
Yeah.
Are you normally generally fit and well?
No, I'm bulimic, yeah.
Okay.
But I am well, but I've been bulimic for like 10 years. So.
Okay, so what's your diet like at the moment?
I don't binge eat so much, not anymore, but I do throw up every time I eat.
Do you think it's related in any way to having an empty stomach and not having eaten, and then do you think that it's at all relieved by then eating?
Probably.
Probably.
I don't know.
The other thing...
My eating pattern is just so ridiculous. Sometimes I can go 2 or 3 days without eating.
Okay.
And then I can just eat normal, or I might binge eat, or I have no consistency to my diet.
Right, let's have a feel of your tummy then. If you just have a lie down on the couch for me a second. Let's have a feel of your tummy lower down here. And have you been passing urine okay?
Yeah.
No burning, stinging, pain?
No, not that I've noticed.
Any pain there?
I don't like that.
Don't like it, but not painful, though?
No. Yeah, that's right. More just uncomfortable.
Okay. Right. Come and have a seat again. So, have you been emptying your bowels okay?
I never do. No,
At all?
I can't have a bowel movement without using a suppository.
Right, OK. So it does sound like it could be gallstones. The other thing would be something like a stomach ulcer. Have you ever had any acid reflux or a feeling of, like,
I always get that, yeah.
Have you ever told anybody about that?
Well, no, because I always thought that was a bulimic thing. Like, you know that I just assumed in my head that because I'm eating, throwing up, my stomach's producing acid.
Yeah.
And then I'm throwing up the food, and so I'll have excess acid. So
which you will do, and that logic makes sense. But the problem is the fact that the acid is then there in an empty stomach, so the acid can be breaking down the lining of your stomach, giving you a stomach ulcer. So start with this, because this could make a difference. If it is a stomach ulcer, this should really help.
Okay.
But what I want you to do before you start taking them is the stool sample. You're not going to be able to do that, are you?
No, it's not going to happen.
The reason being because sometimes there's a bacteria called H. pylori that can live in your gut. Loads and loads of people have it, and quite often it doesn't cause a problem, but it can start to cause you problems with heartburn, indigestion, acid reflux, things like that. So if you can, if you manage to
Yes, I will try.
bring that back for us.
I always try, if I'm honest.
And then make an appointment to come back and see Dr. Pelly, and then he'll be able to look at getting a referral to do whatever tests they think they need to do.
Okay, I'll give it a go, thank you.
All right. Have a good week.
And you.
See you later.
Bye-bye.
Bye.
Hello.
Hi, come on, Dave.
Hi. Okey-doke.
So I'm Dr. McLaren. It's nice to meet you both.
Yeah.
Okay.
I'm here with Evan regarding a bit of a sort of ongoing problem.
Okay.
Evan's been on antidepressants, but hasn't been on them for the last sort of 4 weeks. So he's gone back to sort of quite heavily with drinking and smoking.
It's only cannabis.
Okay.
I thought, is there any point? OK, I need to be taking the tablets, but if I'm still smoking and I'm still drinking, what's the point of taking the tablets when they're not going to be doing nothing to me? The problems and everything that I had going on seemed like they weren't getting no better.
You know, it's a difficult situation. He's going away today.
Okay.
I'm going to go and stay with my brother for a week to get him away from Bristol. But we wanted to see if there could be, you know, I don't know if it's counselling, a drug programme. You know, there needs to be something.
Yeah. You've mentioned drugs and alcohol earlier on. Tell me what's going on at the moment there.
When I feel low, I'll turn to the drink. Have like a couple of cans. And then where I've had a couple of cans, that makes me feel happier in myself.
How much do you think you drink?
Only 4 to 5 cans. It's not like I won't binge into like spirits and all that. Like, it's just
lager.
Lager, like.
Okay. And drugs as well. So
it's only cannabis. I'm only a cannabis user. I've never touched no other
But
drugs.
you've been like that since about 18.
16.
Sort of 17, 18. You know, even though as a family, we still support him and try to do what we can. We don't know where to go with it anymore. You know, where do we go as a family to try and get him the help and support he needs?
Have you been in the wars?
I fell down the stairs.
Oh, dear.
Yesterday I was cycling, and then 26 ton of lorry come in. I was in this blind point office. I was on my side.
Oh gosh.
I'm running down the escalator and I just tripped and fell.
And in the end, he sort of hit me really bad. Then I just pushed me off my bike.
Yeah.
And my bike just got crushed.
Yeah. Because I broke my ankle bone down there, and I also damaged my knee.
What it is, my hand.
Yeah, what did you do?
I literally fell on it really hard.
My ligament of my little finger went.
Yeah. And have you injured anything else?
Mainly my muscles, my neck, and my shoulder.
Yeah.
I think I've done something to my back.
Right, OK.
I twisted my back on Monday because I work up the hospital.
OK.
And I had an old lady, and I tried to make her roll on her own, and she didn't.
OK.
So in the end, I sort of ended up pulling the sheet out from under her.
Yeah,
And as I went like that, my back...
Right, don't do it again.
No.
OK, all right.
And over the past couple of months, I've been getting shooting pains down my back and in my leg, and it's sciatica.
Okay.
But it goes, then it comes back.
Okay. Has that changed at all?
No.
No. So this is something different that you did?
Yeah, it was
for
just on,
patient.
like I said, on Monday, I was like up and I was rolling this lady from this side of the bed. And I went like that, pushed her, and I was holding her up, and as I was holding her up, I could feel my like pain in my back.
Sounds very much like you've just sort of strained a muscle in your back, doesn't it?
Thank you.
Okay.
Yeah,
Let's
it
just
hurt.
have a yes. I'll just have a little look, okay, just to make sure it's not anything else. So it's all on this slightly on this left side.
It's on this side. It's
Yeah,
always on
okay.
my left side that
Is
that
it?
the pain is.
Okay, all right. And it's turned around here, is it?
Yes.
Okay, all right. I mean, you just need to be really careful lifting patients and stuff, don't you?
Oh yes.
Okay.
Oh, I know that.
Right. Okay. I mean, what's going on about your
It's
sciatica?
my age anyway, isn't it? That's what I'm told, and I'm overweight.
Yes, that won't be helping.
No, when my doctor's left, and he said, "You're very obese."
Okay, that was a polite way of putting it, wasn't it?
And he said, "You have to do something about it."
Okay. All right. So, are you doing it?
I'm trying, but
It's just
now
talk-
I'm
it
retired.
is hard.
I'm starving all the time. I mean, I'm continuously not being funny.
I
but
thought you weren't retired. You're working at the hospital.
I work only part time.
Oh, I see. Okay.
But
have you got weight? Are you doing Weight Watchers or anything like that?
no, because see, I have depression, anxiety, and panic attacks, and I'm having major panic attacks again. They've started up again really badly.
I just wonder whether I should refer you to Weight Watchers or anything. Would you like?
I went up to the gym once, and
Once doesn't
no, I had a
usually
panic
work.
attack,
Ah, okay.
major panic attack. But if I get the hang of it, I would like to go again
Would
to
you
the
like
gym.
me to send you back to the gym?
Yes, please.
All right.
And I will go.
Okay. All right.
The thing is, I think because you're depressed, you eat, and because you eat, you're overweight.
Yeah,
it's a vicious circle.
It's a vicious circle. Absolutely.
And I've
yeah.
now got into it that I can't get out.
Yeah. No, that's right.
But
Okay.
I look at people going to the gym and I think I'd love to go. I really would.
Okay. All right. Well, brilliant. Let's see if
and
we
I will
can,
go this time.
Good. Okay. Let me just.
I've got my tracksuit bottom ready.
Oh! You are just going to be on it, aren't you?
Oh yeah.
Good morning, can I help?
Hi, my daughter, she's got conjunctivitis. She needs to see the doctor.
I can take your daughter's date of birth, please.
It's the 30th of January, 2011.
13th of January.
14. How am I messing it up?
So, what do you think we should do?
Give me some sort of help.
Okay. Did you have any particular type of help that you thought would be useful?
I don't know. It's hard because I find if I'm active and I'm doing stuff, it takes everything away off my mind.
So what happened with Rhodes? Have you got their contact number?
Have I got a contact number
For Rhodes? In terms of support, because it looks like you're looking for a bit of support,
Yeah.
they actually quite like the call to come from you.
Yeah.
Because I guess
instead of them coming to me.
Yeah, well, instead of me saying, you have to go and see them,
Yeah.
it shows that that's something you want to do. If you take
Do it off my own back.
ownership. Yeah, exactly.
Another thing as well, whilst I'm here, is I've run out of my antidepressant tablets.
Yeah. What do you think we should do? Because it sounds like you weren't that keen to take them. Do you want to try them again? Try
It's
something
not the
else?
antidepressants, it was more of the diazepam that was keeping me happier and more bubblier in a person.
Diazepam, I'm quite reluctant to prescribe. The reasons being are it's very addictive, and I guess you've showed that you've had some difficulty with impulse control and with substances anyway. So I feel like I wouldn't be doing you any favours by giving you more diazepam.
Yeah.
But we could think about a different antidepressant to see if that has more of an effect if you wanted to.
I feel like the antidepressants that I was on weren't actually doing nothing.
Okay. Well, let's try something called sertraline. You've not had that one before?
No.
Okay, if I give you a couple of weeks' worth, and then when you come back, you
Make an appointment to see a ring doctor or whatever, yeah.
Yeah. I think it's good that you've come in, I think that we do need to make some changes. Some of them will come from getting the right support, and some of them are things that you know...
I need to do myself, yeah.
OK, lovely.
OK.
Do I need
Thanks
to
very
sign
much.
it and that?
No, you just take it into the pharmacy. You don't pay because you're on benefits anyway, so...
No, that's what I mean. I've got
OK.
to tick the box and
Thank
sign
you.
at the back, haven't I?
Yeah.
Right, thank you.
Now, Ken, you're here for your diabetic bloods, yeah?
Yep.
How are you feeling today, all right?
Yeah, not too bad. Yeah.
The sun's out today.
Well, they say sunshine on the righteous, don't they?
Exactly, they do. Don't know what happens all the other days in Bristol, but there you go. What are you doing today? Anything else?
I'm up at the hospital because I'm a voluntary driver out there.
Oh, OK.
That's Southmead.
What, one of those drivers in the little mini golf things?
No. I've been driving for mental health and North Bristol for 26 years.
Wow.
You know.
So do you drive the patients home and
I
stuff?
drive them home, and also with mental health, we used to have loads of groups outside. But of course, with cuts, all those things are gone.
Yeah. So you've been volunteering for that whole time, have you?
Yeah.
Yeah, all right. Don't they have a cut-off date as well as in age? I'm sure somebody come in and said they had to stop because of their
they
age.
say they're in their 80s. You know, as long as you can walk.
OK, then, that's you finished.
Right, so...
All right, then,
Okay.
take care.
Bye.
Bye now.
All right, Mr. Newton?
Yeah, thank you very much.
OK.
Come on.
Bye-bye.
Bye.
Right, yes, all right, well, thank you for looking. No problem. All right, take care. All right, bye.